Healthcare workers say the risk of contracting the Ebola virus is low.
But that may not ease the minds of many of you with so much news coverage of the first case of Ebola diagnosed in the U.S. A man who traveled from Liberia has tested positive for the disease. Doctors at a Dallas hospital are treating him. It's raising questions. How is the disease spread, and are we prepared? KFDM's Haley Bull investigates the planning at a Beaumont hospital to keep patients and staff safe.
Each day, dozens of patients arrive at Baptist Hospital in Beaumont. Today, while they're thinking about their own problems, the fact a patient in Dallas has the Ebola virus may also be on their minds.
But I think overall for our risk in Beaumont, it's very minimal.
Healthcare experts say it's likely the patient in Dallas contracted Ebola in Africa.
Ebola in itself is actually a very low-risk disease because it's not spread by coughing or sneezing or casual touch.
Dr. Thompson is the attending physician in the Baptist Hospital emergency room.
You'd have to come in contact with body fluids such as blood or feces or heavy sweat.
According to the Centers for Disease Control and Prevention, symptoms can appear anywhere from 2 to 21 days after exposure to the virus. Each unit in Baptist Hospital has a room like this. It's an isolation room normally used for airborne infectious diseases, but it's also equipped to handle a case of Ebola should it come through the hospital. The hospital could also use any other room to isolate a patient, and staff would use gloves, gowns, and surgical masks to limit exposure.
You're going to reduce the risk of exposure to others in the waiting area and puts the staff on high alert to ensure that the appropriate infection control measures are in place as well.
Deborah Marcinick is the Baptist Hospital Director of Infection Prevention. She says the hospital is also planning drills to be ready just in case.
Staff get the feel of caring for a potential Ebola patient and how you would have hands-on experience with managing that individual after they've been identified.
Identifying potential Ebola patients while remaining aware the risk of contracting the virus is low but not impossible. In Beaumont, Haley Bull, KFDM 6 News.
Now, it is important to repeat, according to the Center for Disease Control, Ebola cannot be spread through air, water, or food. To learn more about how it is spread, as well as symptoms and other information, log on to KFDM.com.